Come in.
Hi, are you Chris?
I am.
Hi, my name's Colin.
Hi, good to meet you.
Good to meet you too. I'm one of the occupational therapists on your team.
Oh, very cool.
Yeah, absolutely. I know you've been talking to Dr. Jung.
Yes.
And from looking at your records, it seems like the team is thinking that you have a shoulder impingement syndrome. Does that sound familiar?
Yeah, I think you mentioned it, but I'm not really sure what that even means.
Totally. Yeah. The shoulder is really complex.
Okay.
But so, do you mind if I break it down?
I don't mind at all.
Fabulous. So when it comes to shoulder impingement, first we have to understand the basic anatomy of the shoulder. So it's not one spot in your body, but rather a bunch of bones and how they interact to create a mobile joint.
Okay.
So two of those bones are your scapula, this flat bone on your back, as well as your humerus, so your upper arm bone.
Okay.
So when that flat scapula and the arm bone articulate in the socket here, there's actually a little lip on the top of the scapula called the acromion process.
Okay.
When the arm bone slides and rolls and moves around, which allows our joint to be really mobile, there's a little bit of space between the acromion and the humeral head, and we call that the subacromial space.
Okay.
Just fancy word for a little bit of gap.
Yeah.
In that gap, there's a lot of important muscles that connect the bones together, tendons that allow them to move, and in a fully functioning shoulder, the humerus is able to roll in that space without there being any compression. What happens though is that sometimes if there's been a traumatic incident like a fall, or perhaps there's just a little bit of movement imbalance, whether that means that the shoulder blade isn't moving correctly on your back of the spine, or perhaps your humerus bone isn't moving correctly within that scapula connection, or simply sometimes simple as poor posture.
Okay.
Over time, this repetitive movement will cause compression. So as the humerus goes up, rather than it sliding back down, it compresses the tissues between the two bones.
Okay.
And if it happens once or twice, you don't notice it, but it's the repetitive nature of it that over time starts to harm the tissues in that space.
Okay.
Have you been feeling much pain or like limited range of motion at all in your activities?
Honestly, I feel a little bit of pain and a lot of soreness in the evening after I do like stuff that I have been doing for a long time, just like normal workout stuff like rock climbing, or if I'm cooking and that meal takes a longer prep time.
Sure.
Or even sometimes like if I'm sleeping on my side, I'll wake up in the morning with a lot of soreness too.
Okay, yeah. And that sounds like pretty typical symptoms of a shoulder impingement injury.
Okay.
Typically, there's a little bit of pain, or I shouldn't say a little bit, there's pain when you lift your arm to shoulder level or above.
Yeah.
Or if you're reaching behind your back, causes your arm bone to move forward in that way, which can compress.
Okay.
So it kind of sounds from the activities that you're saying that that's a little bit of what you're experiencing. Would you agree?
Yeah, I think that's right.
Wonderful. So with that said, even though I know that that is not fun to experience, it does sound from your symptoms that we're at least at the beginning of the spectrum of what a shoulder impingement injury can be.
Okay.
So at the beginning stages, there's pain like you're talking about during your daily activities and as you're sleeping when you lie on it. And because what's happening is that those tissues in your shoulder are getting inflamed and they're getting harmed with that motion. What happens if that continues is that those tissues will develop a thicker layer called fibroid.
Okay.
And that'll continue to take up space in that shoulder space. And that'll further limit range of motion and cause more pain. Eventually what can happen is that if that damage continues to occur over time, the tissues themselves start to degenerate, they can tear, even the tendons can break, and then you fully lose the function of your shoulder.
That doesn't sound good.
No, that'll lay you up for a while.
Yeah.
So even though I know this is not a fun experience, it's good that we're catching it at the beginning and it gives us a lot more options.
Good, okay.
Absolutely. So how I, as an occupational therapist, fit into your team is that our profession is really specialized to help with repetitive motions that occur in everyday life.
Okay.
So things you're talking about, cooking, sleeping, activities that you enjoy doing. My goal is to get you back to doing all of those things again, pain-free.
Great.
And so we do this in a couple of ways.
Mm-hmm.
So first, our focus is going to be on reducing pain and inflammation.
Okay.
So things like modalities like ice packing, slowing down that swelling or reducing it completely, as well as just modifying how you're doing tasks so that you're not unwittingly making it worse.
Okay.
So we'll try on different strategies just at how you can do normal activities, but perhaps without lifting your arm as high as you usually do.
Okay.
Might require some assistive technology or things like that.
Mm-hmm.
Then once we have that pain and inflammation under control, we're going to move into restoring range of motion. This might look similar to things you'll do in physical therapy with manual exercises. First, focusing on the therapist passively moving your shoulder, and then working into more of an active range of motion where you're really facilitating those large movements. In occupational therapy, however, we're going to translate that range of movement into, again, activities that you do in every day. So even though we're starting from an adaptive place, how can we get you back to not having to think twice about how you're using your arms? Then once we have that range of motion restored, we're going to work on strengthening. This means strengthening your muscles, but also your movement patterns.
Okay.
So the way that your shoulder blade curves around your back, the way that your arm bone moves mid-socket. However, all within the context of what you do in everyday life.
Okay.
So we'll look at things like exercises to facilitate that, making sure that you are sleeping appropriately so you're not accidentally causing more damage while you're sleeping, and as well as simulating activities you like to do, like rock climbing, things like that, and just analyzing those things for how can we make sure you can continue to do those without putting any stress on that joint.
Great.
And hopefully then also returning you to work and other things like that that are really important to your everyday.
Okay.
Yeah. When it comes to your treatment plan and the way occupational therapy fits into it, do you have any questions for me?
No, I think that's super clear. I guess I'm wondering a little bit about like the timetable of something like this.
Absolutely, because we want it to get quick as fast as we can.
Yeah.
Absolutely. So when it comes to shoulder injuries, it's a really complex joint, so there is no typical time frame.
Okay.
It really depends on the muscles that have been impacted and which ones we need to strengthen. However, usually it can be anywhere from 3 to 6 months of treatment will restore someone to full function. And that's actually really great news.
Okay.
Because if we had to go with surgery, that would be about a 9-month therapy period after surgery.
Yeah.
Yeah.
Okay.
So this conservative treatment, we'll focus on this for about 3 to 6 months. How many times we see each other during the week will depend on your insurance and your team's perspective on just your care.
Yeah.
But then if after that 3 to 6 month period, you're not feeling any relief, then we might look at surgery for an option.
Okay.
Yeah. Any other questions?
No, super thorough explanation.
Awesome.
Yeah.
And so the only parting things I really want to emphasize as we leave is just making sure that we follow this protocol in the sequential way, and that really means focusing right away on reducing pain and inflammation. So avoiding any activities that are going to cause pain, even if I know that those are the ones that you're excited to get back to.
Yeah.
The quicker we can get that shoulder to be pain-free, the faster we'll be able to work into these therapy modalities of increasing range of motion and strengthening, as well as making sure that we follow this protocol in this really logical way so that hopefully we can avoid surgery altogether.
Great.
Wonderful. Okay, thank you so much for your time.
Thank you so much.
Lovely to meet you.
Nice to meet you.